Dr. K, Dr. Kevin Kavanagh. He's a retired physician from Somerset, Kentucky, and is also founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Glad to have you here this morning. Start with the biggest story in the news as it relates to COVID would be that a major blow for the White House. The U.S. Supreme Court blocked President Biden's vaccine mandate for large businesses. The court ruled yesterday that OSHA was overstepping its authority by declaring vaccine or testing mandates for all businesses with more than 100 employees. The mandate would have affected more than 80 million Americans. However, the court will allow a vaccine requirement for healthcare workers to continue, affecting about 10.3 million workers in hospitals, nursing homes, and other facilities. What are your feelings about large-scale vaccine mandates, and should employers be allowed to enact their own mandates, in your opinion?
Definitely. We've always felt employers should be allowed to enact their mandates. I think that's of utmost importance. You have a lot of people in our nation who are immunocompromised. They are very susceptible to this virus, and they need to go into a facility that they feel is as safe as it can be. Vaccines are not 100% effective, but they do provide a good level of armor, and they will cut down on viral spread. Healthcare worker mandate, we totally agree with that. Our group back in April of 2021 actually wrote an article requesting mandates for healthcare workers. Because as you know, in a healthcare setting, patients oftentimes do not have a choice of where they go. There may be only one hospital in a county. Patients are oftentimes immunocompromised. These are the frailest of patients. They're placing their trust in other individuals. And to have this trust violated by a person who has not been vaccinated and has an increased chance of shedding or spreading the virus, that to me is just unacceptable. So we are in total agreement with the healthcare setting mandate. I think that was a wise decision on part of the court.
President Biden announced also yesterday that he was directing staff to purchase 500 million coronavirus tests for distribution. That's double the number of tests previously purchased by his administration, and that will mean 1 billion with a B tests in total to meet future demands. And he says, this is a quote of the president, and will continue to work with the retailers and online retailers to increase availability. President Biden also said, but they're going to be sending personnel to 6 states needing emergency help in hospitals. Now, no specific date has been announced for distribution. He made some reference to possibly next week. He says we're on track to roll out the website where you can order free tests shipped to your home. Your thoughts on that?
Well, these are all good steps. However, they should have been taken like early last year. As you know, Jack, on this program, we've called for N95 masks to be used. I believe it was back in July before the Delta variant surge. We've had several of our leaders, including Rand Paul, that were sounding the alarm saying, look, we should be using N95 masks. I believe Dr. Paul has advocated for that for a long time now. Dr. Wen, who's a commentator on CNN, she has also been advocating for N95 masks, yet the CDC is not willing to set that as a standard as of this point. They're not adverse to you using it, but they won't say that they're required. And I think that's an error. I think that you're seeing the White House now getting out and starting to lead and do something. But again, this is far too late. And as far as the tests go, Jack, we need to have many more tests. And I'm very scared that the White House effort is just a shell game. In other words, they're taking it off of CVS shelves to be distributing it to other people. And that is going to be at a later date. And so you're really putting off testing during the peak of the surge. I feel quite strongly we need to up the production of these tests. These tests, especially if they're the rapid antigen test, they don't necessarily test for the spike protein. They test for other characteristics of the virus. So they're somewhat resistant to changes in the variants. And I can tell you, as we've described on Monday, we've had very good experience as far as monitoring outbreaks with these tests and found them to actually correlate fairly well with the PCR test, at least in the one instance that they were checked. So I do think there are steps in the right direction, but we are far behind in getting our nation geared up to meet this surge.
I found that story. Biden said that he will send 1,000 medical personnel to 6 states needing emergency help in hospitals. You mentioned Dr. Fauci, and of course, obviously, he has been in the news this week, particularly with the meeting that took place, I believe it was on Tuesday. And Dr. Fauci says, this is a quote, just about everybody will eventually be infected by the Omicron variant. The leading expert in infectious diseases says the mutated virus is so easily transmitted, it will make its way to just about everyone before the pandemic is over. Omicron, with its extraordinary unprecedented degree of efficacy of transmittability, will ultimately find just about everybody. Those who have been vaccinated and boosted could get exposed. Some, maybe a lot of them will get infected, very likely, but those who have been vaccinated and boosted should not suffer serious effects. You agree with that?
I do, but I think that there are several caveats there the public needs to understand. One is this variant isn't as mild as what the data is being spun to indicate.
Really?
Well, yes, and we've talked about that because it's including breakout infections and also reinfections in those people that have been recently vaccinated and infected. And so if you read an article, for example, that's just recently published in The Atlantic calling Omicron mild as wishful thinking, I think more along those lines. If you have an immunologically naive immune system, if you're immunosuppressed, if you haven't been vaccinated, you may well have the chances of getting severely sick similar to the wild type virus. And that's something people need to remember. A lot of the data this last week has been totally confusing. For example, ABC misquoted by cutting out the CDC director statements indicating that at least 75% of the people that were dying had 4 comorbidities, when if you heard the entire statement, she was only talking about the vaccinated people. Those were the ones that, yet that was cut out and spread across the news media that, well, this is just some sort of a very mild virus. We don't need to worry about it. And there's also, as we talked about on Monday, the fact that many people are entering into the hospital with things other than respiratory COVID. Remember, this virus affects every organ of the body, including the heart, vasculature, can cause strokes, heart attacks, etc. So, got to be careful. The hospitals are filling. If everybody gets infected, don't think that's a prescription to go out and get this virus. What you want to do is at least put off infection if you're going to get infected to where the healthcare system's not filled. Monoclonal antibodies are available. The oral antivirals are available. Right now, we don't have many treatments. It's not a good time to get infected.
I found another quote from Dr. Fauci I wanted to run by you, Dr. K, and see if you agree with him on this. He said that while virtually everybody is going to wind up getting exposed and likely infected, if you're vaccinated and you're boosted, the chances of you getting sick are very, very low. Now, a day before that, Fauci said in that Senate hearing that unvaccinated people are 20 times more likely to die, unvaccinated, 20 times more likely to die, 17 times more likely to be hospitalized, and 10 times more likely to be infected than those who are vaccinated. Do you agree with that?
Well, that's about the range of the numbers that I'm hearing here in Kentucky, that we have over 80% of those in the hospital are unvaccinated and over 90% are unvaccinated that are in the ICU. So it's within that range. And certainly if you're vaccinated plus boosted, that your chances of getting severely sick are small. It still can happen, especially if you're immunocompromised. But I should add that this narrative or debate of, whether it's natural immunity or 2-dose vaccine immunity, which is greater, it's really immaterial. Neither are good if it's been out for some time. In other words, more than 5 months, you need to get boosted. And with natural immunity, if you had a mild infection, you may not have good immunity to begin with. So that is very hard to judge.
Let's go to the phones. This is Rick. Good morning, Rick.
Hey, good morning, Catfish. How are you?
I'm good, thanks.
Good. That'll go back a ways.
Yeah, that does.
Dr. K, got a question.
Go ahead.
I got tested Tuesday for COVID. I have not gotten my results yet. I'm trying to get the Wild Health to get back with me, but it just, you can't get them to call you back. But I got a question. Why are they not doing throat swabs for Omicron? Because I had a pharmacist tell me that the nasal swabs for COVID will not detect Omicron. Is that correct, Dr. K?
No, the nasal swabs still do detect Omicron. We were able to do that quite successfully in one of our family units. I think they were 4 out of 4 positives that were very happy with the performance. There is some discussion that maybe throat swabs might be better, but they're still studying that. But it's still highly effective with the nasal swabs. But I do think your point of waiting all this time to get a test result is simply unacceptable. These need to be back within 24 hours, preferably the same day, even if it's PCR, and that's 24/7. Because with these antivirals, you're going to want to start them within 3 days. So let's say you're told you're positive. How are you going to get to your doctor's office, be seen, get a prescription, and get a monoclonal antibody infusion? It's this type of delay is unacceptable. We need to streamline our system.
My work is getting really put out with me because I keep calling them and telling them I haven't gotten my results, but I'm not going to go back until I get my results. I do not want to infect my whole crew.
Well, and that's a good thing, because remember, it's not just if you're going to die of Omicron. If you get severely sick, plus you infect everybody else, because this is highly infectious, and all of a sudden everybody's off for 2 weeks, that's a big problem. And that's what we're seeing here with the supply chain. Remember, for the last several years, I've been saying, using death to measure public health success is an extremely low bar. I mean, even mild sickness, if it occurs in mass, can stop supply chains.
Right. I'm 70 years old. My wife is 75. We're caring for her 95-year-old mother. I've had all of my shots and boosters. My wife has had all of her shots and boosters. We're raising our granddaughter. She's had her shots and boosters last Tuesday. And my mother-in-law has had all her shots and boosters. But being as old as we are, I'm just worried about not hearing back what's going on.
Well, I can understand that. I can understand that because, again, when you're that old, you may actually be immunosuppressed. The vaccines may not be that effective. I can tell you that in my family, we have 2 units, one vaccinated, one not vaccinated. Vaccinated one, Omicron went through, caused mild illness. In the unvaccinated family unit, they had severe problems with one of the family members still in the hospital after 2 months and just getting off the vent. So it can be problematic.
I appreciate you. I just don't want to get fired for waiting so long.
Yeah, I don't think they can do that.
Yeah, I don't think they could do that. If I would be surprised.
Yeah. I appreciate the call.
Okay.
Thank you, Rick.
Thank you.
Be careful out there. Now, do you think, I know they say that the peak of Omicron has sort of passed in the United Kingdom. Do you feel like we're approaching that level or no?
In some of the big cities, it looks like, if you could remember, Jack, from the get-go, I've said I think this peak is going to be very large. It's going to be a major peak, but hopefully short-lived. And that's what I'm hoping for. And then again, if we do not get another variant, maybe we'll be getting out of this pandemic. I think we'll be getting more into an endemic stage. And that's what I'm also hoping for.
Oh, boy, I hope you're... I know you're not saying that that's what's going to happen, but I hope your thoughts are right. Hey, thank you, Doctor. Have a great weekend.
All right. Thank you, sir.